Well, one organisation which has opposed the bill is the Public Servants Association, a union which represents workers in the public service. Reuben Maleka is their Assistant General Manager. He's been watching all of this as well. Reuben, good afternoon to you. You want to retain medical aids. I imagine most of your members belong to the Government Employees Medical Scheme, GEMS. Why do your members want to stay in that system rather than have an NHI?
Yeah, thank you very much, SG, and good afternoon to the listeners. Let me start by making this comment, SG, by saying, if you recall, in 2017, December, the former president, Jacob Zuma, made, unprecedented announcement that there would be funding of all higher education, pre-higher education. And come February 14, he resigned as the president. Today, we are 14 days before elections. This bill has been, muted for quite some time, over a decade. And 14 days before the elections, we get the bill being signed into law. So I'm just making these remarks. And one other remark that I want to make is the part of saying, I thought the Minister of Health would commit to say that as parliamentarians, they would immediately stop having medical aid. The parliamentary medical aid scheme would immediately stop, but he says that that is not the immediate, intention. So that already tells you that we might not see anything happening with this bill that has been signed for quite some time to come, 10 to 20 years. Nothing really would intangibly happens, because we as the PSA, we have the view coming to a question that there is no need to scrap the private sector. There's no need to do away with medical aids. In fact, one look at this process of NHI, it simply means free access to private healthcare services. That is what it means, because all what is required is that the access to better healthcare, which is where you can get medication, where you can get nurses and doctors available when you are sick. That is the NHI intention. And going back again, it tells you the story, and that we've been saying as the PSA, that the current state of public health is at a state where there are no such resources. If you go to a clinic, you will not find adequate medicine. Probably you might not even get a cough mixture this winter when you get a flu. Secondly, if you go to a public hospital, you might not get a bed. You might sleep on the floor. It's a reality. The queues are long. So the whole issue of NHI is simply say that let's have free access to also private healthcare services. But our plea to government and to NHI was that let's not do away with the private healthcare, because doing away with private healthcare or medical aids, we are simply having to come and collapse all the health system, including the private healthcare, because we all know that currently the public healthcare is not adequate, is not able to provide these services. There are not enough doctors, there are not enough nurses. So that is the reality.
Okay, do you believe then that an NHI system is not possible, or do you believe that it can't be implemented by government?
Look, it's a noble idea. The PSA support the universal health coverage, but the current state of economy, the current state of governance in our country does not allow any chance whereby this service, a health service, can collapse. So our most fear about the whole situation about bringing in the private, collapsing the private sector in the interest of NHI is that we'll end up with a situation where the whole system has collapsed. And there's also contradiction, SG, because, as much as now we are saying, let's do this process in health, it's not happening in other sectors of government. Government is now in the process of outsourcing the correctional services. We've got G4S in Bloemfontein because the belief is that the private sector is doing better. Then you have also the PPEs in the ESCOM now being introduced because ESCOM has been failing. And they're helping ESCOM now. Probably that is the reason why today we do not have load shedding for more than 50 days. We all know that the police on its own is incapable of dealing with crime. That is why there's private securities that assist with community-based, where people can be able to hire securities for their own protection. So that tells you that there is no proper public service by the police. So why would today, when the critical sectors of the of government, which is police, health, education, and obviously criminal justice in its totality, including correctional services, where the government is outsourcing, is partnering with private to ensure efficient services. Now suddenly, where it has been, well structured, now we are saying let's do away with the private healthcare or private medical aid so that we can have one NHI bill. So it's a contradiction. It's imbalances that we don't understand why government would target health to do away with private healthcare collaboration, and while they are extending it in the correctional services, they're extending it in the police, they're extending it in education.
So sure, Reuben. I mean, look, the correctional services thing was signed 20 years ago. Those two contracts at two prisons, one in Mangaung, one in Limpopo. They're both going to be abandoned. They're both ending now. I do need to put another question to you. So your members work in government, and it would be your members who would have to implement parts of the system. Some people may hear you, Reuben, and suggest that when you talk about governance of the healthcare system, that maybe your members are just not able to implement the NHI properly.
Look, obviously, our members on duty, we always encourage them to respect their functions and their duties, and we always encourage our members to ensure good governance and efficiency. And we always, as the PSA, advocate zero tolerance of corruption by our members. Even our members that comes here for assistance, if the issue is about corruption, we advocate to say, as the PSA would not want to see our members be involved in corruption, and therefore, the issue is that it's always start from the head when this kind of happening of corruption and maladministration happens. And it happens when, like for instance, the issue of NHI. Let's now guard against to say there would not be any cadre development. Inexperienced, uneducated, lack of skills and knowledge to a position. We don't want to see that in the first place. We don't want to see somebody with no knowledge, skills, experience, and education occupying a position to say this is the relevant person that is going to administer NHI. Because the cadre deployment, or without those things that I've mentioned, is the one that kills the public service. And we want capable, experienced, skills people to manage the public service to ensure proper administration, normal administration, and no corruption.
Reuben, if government continues down this road, are you going to join the court action against it?
Look, at this point in time, we have not sought, because we are a mandate-driven organization, democratic organization. We haven't had many of our members, advocating that we must also challenge this kind of the bill in any court. I can assure you that we are having a full discussion of broader membership delegates this weekend, starting from Sunday and Monday, and I believe that if our members are of the view that they need to debate this particular matter, they'll debate it and they'll provide us mandate. Come Monday, I believe that we should have a position as to whether the members are of the view that we should also join the court process. But at the same time, this kind of action, because they are more of political nature and civil, we also have our federation, FEDUSA, and I'm sure at the level of the federation, there would be a position as to what action would be taken in terms of this bill, Reuben, or this act. Let me say the act because it's already signed.
It is indeed, Reuben. Thank you very much indeed. You're correct. Assistant General Manager of the Public Servants Association, very strong view. Thank you very much indeed for that. All right, more to come clearly from the PSA.